Everyone talks about the advantages and disadvantages of studying MBBS, but no one really starts with the question, who should study MBBS? This question is crucial to discuss with students as it creates awareness. Building a career in medicine is unique and incomparable to any other career. Medicine is not just a profession, but a service to humanity. It is one of the most common, yet most challenging, degrees in the world. Future doctors and healthcare professionals have to go through rigorous academic courses and residency programs to work in the medical field. However, if the goal is to save lives and ensure safety, the effort is definitely worth it. So, who should study MBBS? Let's dive into it. We will discuss a few important points to consider before embarking on the MBBS journey. This information is not typically shared by career consultants or agents, but National Vidya Foundation is here to help you. Before committing to MBBS, ask yourself the following questions. 1. Can you crack NEET? You may have heard that it's possible to study MBBS without cracking NEET. However, there are no shortcuts to passing NEET. Beware of agents who claim to offer admission in medical schools abroad without NEET. They are misleading you. Don't take admission without passing the National Eligibility Entrance Test, NEET, in MBBS programs, whether in India or abroad. You need the confidence to crack NEET because after completing MBBS, you have to appear for the screening test, next. This test is mandatory for every medical graduate who wishes to practice in India. 3. Do you have the confidence to clear exams? If you struggle with exam phobia and get nervous as the exam day approaches, MBBS might not be the right choice for you. A medical degree comes with a certain amount of pressure. You need to be confident in your ability to clear examinations in order to succeed. Attending regular classes and dedicating enough time to study will boost your confidence. If you can manage your study habits and feel confident about exams, then studying MBBS is a suitable option for you. Otherwise, it might be better to consider other alternatives. 3. Are you willing to work with human cadavers? Are you excited about the opportunity to work with human cadavers? In your medical studies, you will need to memorize the names, shapes, and sizes of bones. If you're interested in gaining practical experience and upskilling yourself by working with cadavers, studying MBBS is a suitable choice. 4. Do you value job security and stability? Have you heard about the stability of medical careers and the high salaries of doctors? Who wouldn't want job security in their desired field of work? However, securing a job depends on your abilities and the validation of your degree. Doctors must possess strong leadership and communication skills, as well as a good sense of humor. They are part of a team that must work well together because mistakes can cost lives. It is important to speak clearly and empathetically with patients and maintain good relationships with nurses, who play a vital role in patient care. After successfully completing the MBBS degree, you have the option to start your own practice or seek employment in the medical sector. 5. Can you handle long study hours? Have you heard people say that medical students study for 18 hours a day? The ideal study hours for an MBBS student are difficult to determine. What matters most is the quality of your study sessions. It is evident that a course like MBBS requires dedicated study hours. It is essential to invest effective hours in gaining knowledge. Gradually stretch your daily learning hours, but avoid pushing yourself too hard at the expense of sleep and exercise. Such a routine is unsustainable and detrimental to your well-being. If you enjoy long hours of study and can manage your schedule accordingly, then studying MBBS is suitable for you. 6. Can you handle exposure to blood and wounds? The medical field involves dealing with blood, pus, and pain. Fainting is a common problem among medical students. On a daily basis, students have to interact with patients in the ward, witnessing blood and wounds. You will hear the painful cries of patients and work with senior doctors. You have to enter dissecting rooms and overcome any aversion to bloodshed. You may have to handle needles and blood tubes and roll up your sleeves to draw blood. If you can handle this level of exposure, then studying MBBS might be suitable for you. If you cannot cope with these aspects, it's better to reconsider your decision. However, if you are eager to experience it all and confident in dealing with the complexities of the medical field, MBBS might be the right path for you. 7. Can you patiently handle patients? In your medical career, you will interact with adults and children. Sometimes, adults may behave childishly, and you have to be patient in dealing with their tantrums. Just as athleticism can be trained and improved regardless of one's starting point, patience can also be developed through practice. Patients in pain, fear, or distress may lash out, and as a doctor, it is important to remain calm and control your anger in order to provide the best care. Understanding the emotions of individuals and taking the necessary steps to address any issues is crucial. Patients will remember the effort you and your team put in to improve their situation. If you have the patience to work with patients, studying MBBS is a suitable choice. Remember, as an MBBS student, learning never stops. Throughout your medical career, there will always be new discoveries and procedures to keep up with. So, if you are someone born to heal others and have a calling to practice medicine, a medicine bachelor's degree is likely the right path for you. Obtaining the appropriate education is the next step in fulfilling your calling.